Hello, this is Dr. Gayatri Deshpande. I am a senior gynecologist, laparoscopic surgeon and a robotic surgeon in the field of gynecology, practicing since 20 years. Let us know about the uterine fibroids, which is the most common problem faced to any reproductive age group woman. I have seen that sometimes even the younger age group less than 25 years can also present with fibroids, as well as the postmenopausal patients, but relatively less frequently. Now, when the patient presents with the uterine fibroid, she can have different symptoms according to the site of the fibroid where it is developed. One thing you must know that more than 95% of the fibroids are benign. They are not cancerous and they don't usually lead into the cancer later on. Maximum the recurrence can occur, but the malignancy is relatively very rare. Depending on the site of the fibroid, whether it is going inside the endometrial cavity, if you can see this is the cavity of the uterus, and if it is encroaching inside, it is called a submucous fibroid. Most of the fibroids are inside the myometrial layer, those are called intramural, and those who go above it, that is, it is going outside the layer of the uterus, they are called subserosal fibroids. The inner ones, that is submucosal fibroid, can give rise to symptoms like heavy menstrual bleeding and bleeding in between the periods also, and these usually present to the woman much earlier than the subserosal and intramural fibroids. For the subserosal fibroids, they may not have symptoms for a long time unless they give the pressure symptoms on the urinary bladder or the rectum. Sometimes the infertility patients who are planning for the baby and not able to conceive, they have fibroids located which can impinge on the fallopian tubes. Hence, whenever a patient presents with the symptoms, we do the investigation with the color Doppler, that is the sonography, and the advanced modality called MRI. With these modalities of the investigations, we know the size of the fibroid, the site of the fibroid, and where exactly there could be a challenge doing the surgery. Coming to the modalities of the surgery offered to a patient, we should always do a minimally invasive surgery for a fibroid patient. Obviously, it will give less blood loss to the patient, less adhesions in the long run, and particularly for the patient who is planning for the baby, the less adhesions, that is getting stuck with the omentum in the post-operative period, is less. That's why the success of the pregnancy is more. Also, for all the patients who have finished their childbearing and have large fibroids which is giving the symptom, those patients we can always offer the hysterectomy, that is the removal of uterus. And whenever there are large fibroids giving these symptoms, the patient usually gets excellent relief with the minimally invasive surgery of the hysterectomy. The advanced robotic surgery also gives a definite better accuracy and the precision during the MIS, that is minimally invasive surgery.